But it was so nice to see how those principles that we taught on day one were really building, and by day 10 all the attendees had these principles ingrained in them, and more importantly than that, they were feeling and telling us that they feel much more comfortable and confident with those principles inside them. And it was really nice to hear that very luckily we were hearing some very positive things about how we teach compared to how, for example, they may have experienced other places teaching. And again, this is not a slant on any other institution. It's just, it was so nice to hear that we were getting those comparisons from a positive way. And doctors who were attending this batch were talking about how they felt included and how the environment was, nice for learning, and how they could take their skills forward going forward. So again, that was really nice for us to hear, because we spent a year trying to prepare this environment for teaching, getting everything right, thinking about everything that we could, and we're really glad that it came off from the feedback that you guys were giving us. With some of the most genuine, interesting doctors that I've met came to our batch one. We had doctors from all over the world: Brazil, Sudan, South Africa, India, Pakistan, Sri Lanka, Bangladesh, Ukraine. So from literally all corners of the globe, and hearing about the struggles and challenges that it's taken to get them to even that point, let alone doing the academy and then thinking about doing the exam in the future as well. So hi guys, Dr. Aman from Arora Medical Education. This video is going to be slightly different to other videos that we have on the channel where we're teaching and going through how to do role plays and looking at clinical guidelines. This is a video where I'm going to try and reflect a little bit on the very first Arora PLAB 2 Academy Plus batch that we ran in July, August this year. So it finished about 2-3 weeks ago. People have been asking us to set up a PLAB 2 academy. This will become a UKMLA academy. They've been asking us for a long time. Obviously you guys will know us for doing a lot of videos around PLAB 2. We've had video courses, audio courses, flashcards, etc. But we decided around 6 months ago to launch our full PLAB 2 academy, and not just an academy. We made a whole academy plus package where we put in 10 days live teaching plus the mocks plus the videos, the audios, the flashcards, etc. And our first batch finished around 2 or 3 weeks ago, and I thought I'd take the opportunity to kind of go through the thoughts that I had whilst we went through this academy, the kind of things that we've taken out of it for subsequent academies. Our next academy plus batch starts in 2 weeks in September. We're already fully booked for that academy. We've got further batches in October, which is half booked already, November, December, January, moving into 2024, of course preparing for UKMLA as well. So we've had a really good level of interest and people booking, and we weren't expecting, to be honest, so many people to book our academy early on. So I thought it'd be a good opportunity whilst we're in lovely Spain. You can see it's beautiful weather behind me. I'm drinking on some lovely Spanish lemon iced tea, which is fantastic. I thought I'd do a quick video on the thoughts that are going through my mind, talking about things like the attendees that we met at the first academy, the tutors that we had and the work that they did, the kind of stories that we heard from attendees, the principles that we've been teaching. So for those of you who are thinking a bit about whether to book our Academy Plus package or not, hopefully this gives you a bit of an insight into the kind of thoughts that we had as a team based on batch 001. So I'm going to start off with the most important people of the academy, the attendees. Now we met, how many was it, 25 attendees in batch one. We kept it capped in terms of numbers to try and improve the teaching experience because we knew we were going to learn a lot. But yeah, just to start off with some of the most genuine, interesting doctors that I've met came to our batch one. We had doctors from all over the world: Brazil, Sudan, South Africa, India, Pakistan, Sri Lanka, Bangladesh, Ukraine. So from literally all corners of the globe, and it was so nice to meet them over a long period of time. Obviously for PLAB 2 I've met a lot of doctors for short periods of time, whether it's a one-day course or a virtual course, but actually getting to know them over 10-12 days was incredible. And the stories that we've heard of how those doctors got to that point was something fascinating for me and the other tutors, certainly Dr. Pooja, the other tutors, hearing about the struggles and challenges that it's taken to get them to even that point, let alone doing the academy and then thinking about doing the exam in the future as well. So first I just wanted to kind of shout out to all of the attendees at batch 001. You were very special to us. You were the first people who came and traveled to us and chose our academy over other places. We understand that it's a big call for doctors to kind of go against the grain and choose a newer academy when you've got lots of other options out there. So firstly, we really appreciate the time, and we really enjoyed getting to know you and hearing your stories, and it really made it hit home as to how important it is for us to get this right to help you guys on the next step of your journey. So the attendees that came, really grateful. We'll always remember you guys as batch 001. We already miss you guys in the academy. The day after the academy, it felt so empty, felt so alone, but it's super that we're staying in touch with you guys. Obviously a lot of you guys have come back from mocks since then. Some of you guys have done the exam already, and we're just really grateful for the kind words that you're spreading, the positive messages that you're putting out there on social media, and we couldn't have asked for a better batch. So firstly, reflecting on the attendees, and I'm looking forward to meeting the September batch attendees, and then later on in 2023 and 2024 as well, because you guys make the academy. Without you guys, nothing would happen. Without your volunteering, without your enthusiasm, and without your trust in booking us, then we wouldn't have an Academy Plus package at all. So firstly, a huge shout out to you guys, and massive appreciation. Secondly, a few words about our tutors. Now, a lot of you guys know we have put together the best possible list and set of tutors that we could to try and help in the PLAB 2 journey. Whether, obviously myself, I've had a lot of experience of teaching for PLAB 2, and I was, it was great that I could put that into action over a 10-day period. But Dr. Pooja, for example, a couple of names that you might remember or know from social media: Dr. Jade was there, Dr. Sahel, Dr. Lucas, Dr. Yashoda, Dr. Vanessa, Dr. Nehal. Some really talented, not just doctors, but medical educators. A lot of you guys know we have 2 or 3 previous GMC PLAB 2 examiners on our team. All of our tutor team are senior NHS clinicians who are working in the NHS doing other clinical jobs, and they do teaching for us as well, and we're super proud of them because the feedback that we got from all of the attendees was that everybody was engaging, helpful, willing to answer questions, patient through teaching, and I saw this for myself. So a big shout out to our team. I'm truly blessed that at Arora Medical Education we've built up a fantastic team. We've got more tutors joining us, and we really make sure that when we select our tutors to join our team, they are the best possible tutors to make the journeys of PLABers and doctors doing things like UKMLA in the future as easy and smooth as possible. So really grateful to have them on our team, and hopefully for those of you who will be joining our academies in the next few months and few years, you'll get to know them and realize just how lucky we are to have such a core, strong group of medical educators on our team. So shout out to our tutors. A few reflections on our principles. For those of you who attended the batch, you will have left knowing our principles inside out. For those of you who know how we teach for PLAB 2, you might have already our gold package or our videos, or have done our mocks, for example. You know we teach a lot about principles. We don't teach a scripted way, we don't teach a formulaic way. We build on the skills that you already have as clinicians, and we teach you how to approach different types of scenario situations. We don't talk about cases, for example. It's all about, how can I get you to a phase where you're comfortable and confident to go and assess any type of situation or any type of role play that comes your way, and how can you build up the information that you need to gather in data gathering, and how then do you take that story forward in the second half. And obviously we teach guidelines, we teach all of those core bits of medical things that you need to know, but a lot of you guys are fine. And one of the reflections I take away is from our batch 1 is that the principles that we taught you made you guys feel a lot more comfortable and confident, and that was our aim all the time, that you need to leave our academy feeling that you're prepared enough to face any type of situation that presents itself in the assessment. Again, we stay very clear of giving lectures, we stay very clear of giving lots and lots of notes, because you guys are postgraduate doctors, you have a lot of talent, a lot of skills, and we just try and hone them a little bit and teach you a little bit about how to stay comfortable, stay calm, and think of that bigger picture that we talk about. So just reflecting on those principles, for those of you who know things like the Arora 3 bubbles of data gathering, the Arora 3 R's of interpersonal, the Arora 3 steps of management, we really did drill these in, and it was so amazing to see how as those 10 days progressed, those principles were coming out in your role plays. Again, we do role playing from day one, so from day 1 to day 10 people are coming up doing role plays, we're getting live feedback. That is how you learn for PLAB 2, rather than being kind of lectured and having to learn lots of scripted material. But it was so nice to see how those principles that we taught on day 1 were really building, and by day 10 all the attendees had these principles ingrained in them, and more importantly than that, they were feeling and telling us that they feel much more comfortable and confident with those principles inside them. So just in reflecting on those, we're going to be doing a lot more of those going forward, and really using those principles to again make you feel more comfortable and more confident as you go forward in your PLAB 2 preparation. Another reflection that's worth talking about is the comparison that we were having to other institutions, other places, academies where PLAB 2 is taught. Now obviously every institution has their own ways of doing things, but we were hearing a lot of feedback from our attendees, particularly those who'd been to other institutions, about just how different the environment is, how different we approach things for this exam, just how differently we teach things in this exam. And it was really nice to see that we weren't just having differences highlighted, we were hearing how the experience was making them feel more comfortable and more confident. So again, there are lots of different ways to teach for this exam. It's not just about this exam, it's about just teaching how to assess situations in general. And it was really nice to hear that very luckily we were hearing some very positive things about how we teach compared to how, for example, they may have experienced other places teaching. And again, this is not a slant on any other institution, it's just, it was so nice to hear that we were getting those comparisons from a positive way. And doctors who were attending this batch were talking about how they felt included, and how the environment was, nice for learning, and how they could take their skills forward going forward. So again, that was really nice for us to hear, because we spent a year trying to prepare this environment for teaching, getting everything right, thinking about everything that we could, and we're really glad that it came off from the feedback that you guys were giving us. A few words about staying in touch. I think what's one of the nicest things about learning together as a group of doctors for over 10 days is that we really got to know the person beyond the exam. And it's so nice that staying in touch has been really good after the academy. We've been having messages regularly between all the attendees. We've got WhatsApp groups that carry on for people who have been to the academy, and it's so nice to hear how people are getting on and hearing how their preparation is going, and hearing, seeing lots of photos come out about the time at the academy. And it just highlighted to us again that the environment that we set, the groups that are formed in those 10 days are not just going to be useful to practice for the next month or so before the exams, but actually going forward when you guys all get out into the NHS, to have those support groups, to have those connections for when you all go into the world of working in the NHS. It's such a great feeling to know that it's come through our academy, and we've got to know you just like you've got to know everybody else, and that hopefully these connections will stay for many, many years to come. I know a lot of you guys will go into specialities that, for example, use the MSRA exam, maybe into GP training, and we'll be keeping in touch with you through those exams as well. But just on a personal human level, just to kind of see how you're doing and how your journey progresses, that staying in touch factor for us is going to be something that we really look forward to seeing develop even further as the years go on. And anyone who's coming in the next subsequent batches, September, October, November, December, etc., we look forward to making those connections with you and seeing how your journeys will progress after the academy. So one thing we always say is, look, when you leave the academy, it's not the end. People come back to practice. It's been great meeting people as they come back for their face-to-face mocks, and we'll be staying in touch as you go further down the journey as well. And as a bigger kind of reflection here, it shows us and it really demonstrates to us that yes, we're teaching you to try and help you get through your PLAB 2 exam, and obviously UKMLA to come, But the bigger picture here is that you guys are all going to be working in the NHS within the next 6 months or so. And it was so nice to hear that the principles that we were teaching, the approaches that we were teaching you, you're telling us that this is helping you for when you work in the NHS as well. Because the bigger picture is, of course, yes, you've got to get through an exam, but understanding how things work in the UK, how certain things can help here versus the ways that you've been used to maybe in a different country. It was really nice for us to kind of realize that, you know, we're having an impact on a future NHS working level as opposed to just getting you through that exam. And of course, at the moment, everyone's mind is on getting through the exam, but the bigger picture is that you guys are all going to be working in the NHS at some point in the future, and the principles that we're laying down for you in these 10 days of teaching are going to help you hopefully going forward into the future. So just some thoughts that I've been having, me and the team, Dr. Pooja, have been talking about this quite a lot since the Academy batch ended. We're always thinking about how can we improve it. We're always thinking about how can we make it better. We're always thinking about how can we make it more valuable. You know, one thing that we're always very keen on is the blended learning approach. You don't just come for 10 days and that's it. You have all of the videos beforehand, the audios beforehand, the flashcards beforehand. So you're already introduced to the principles. And then when you come, it's all about practice, role play, feedback, getting live teaching, so that you're developing day by day. And again, it was so nice to see how that all came together in batch Arora 001. I'm really looking forward to pushing these even further in batch Arora 002. Like I said, the September batch is already fully booked. There are no spaces left in September except for live stream, because we did have some doctors who live stream batch 1, and that's hopefully just as good an experience as if you're face to face. But we do have spaces for October, November and into 2024 as well. So if you're looking for some further information about what the Academy Plus package has, then click the link down below and have a look and read a few more details. Contact us if needed. But I think whilst I enjoy this amazing lemon tea in Spain, you know, when you're away in this kind of beautiful weather, it gets you thinking, it gets you reflecting. And I really wanted to put some of these thoughts into a video just to show you how much it means to us as an organization, as tutors, to help you guys in the PLAB 2 stage of your journey, and to really say, look, I look forward to meeting many of you in the next 2 or 3 years. And if you are thinking about PLAB 2 preparation, it is never too early. Remember, when you book the Academy Plus package, all the material is released to you at that point, so you can go through everything for 12 months. And then when you get to us, we just polish things off and give you that final confidence boost before your 2 mocks and the actual exam itself. But just going to sign off from Amazing Spain. We look forward to meeting some of you guys very soon. We've got another video coming up about why our academy, why we feel our academy is the one to book. But this video is not about that. It's all about the thoughts that were going through my head, the pride that I have as an organization for finally launching an academy, and the thoughts that are making me think, why didn't we do this earlier? Like we said, we were being told for many years to do it, but this was the right time. We wanted to make sure everything was right. We had all the right equipment, the right environment, the right expertise in the teaching team. And thankfully, from the feedback that you guys have given us, it looks like it paid off. You know, the hashtag can pass will pass. We'll see you in the future on Arora Academy Plus program. Take care.